Let us talk today about newborn screening. Newborn screening is screening the newborn for diseases which might be present in them, but at present they are asymptomatic. Newborn screening has saved many a baby's life because the symptoms are manifested about a week or even 15 days after their birth. So if we know whether a person has got the disorder for which they are being screened, then we will be able to save lives. We will be able to prevent morbidity and the mortality of the babies and give them a safe and healthy life. In India, newborn screening is done for congenital adrenal hyperplasia, congenital deafness, G6PD deficiency, sickle cell disorder, and a few other very common disorders, and of course congenital hypothyroidism should not be forgotten about. These disorders are eminently treatable. They are found in quite a good frequency in the general population, and if untreated, then they can cause a lot of problems for the babies in later life. Newborn screening should be done after 24 hours of life and within 72 hours, but sometimes because babies are discharged from the hospital along with their mothers just after a day of after their birth, the screening can be done within 24 hours, but many times it is false positive, so that we need to screen them once more. The screening is done by a simple heel prick test, that is, a few drops of blood are taken from the heel of the newborn and it is put on a special filter paper. This filter paper will then be dried and it can be sent to the lab along with a short history of the newborn along with their identity. If the screening is positive for some diseases, then the lab will immediately notify both the physician and the hospital, and it is the physician and the hospital's responsibility to sometimes do a further testing for confirmation and of course to inform the parents. Screening, particularly for congenital hypothyroidism, is important because replacement therapy with eltroxin can prevent severe congenital hypothyroidism that a baby can be born with. Screening for congenital adrenal hyperplasia by a simple enzyme assay will prevent sometimes the life-threatening complications of adrenal crisis, particularly in the newborn males. So, newborn screening should be a part of every hospital's repertoire in the NICU and even in the wards, because what can be prevented should be prevented by a heightened awareness of the neonatologist and the pediatrician, and this screening test should be offered to all babies universally for the limited number of tests, and if required there is a greater repertoire of tests which is included in the newborn screening panel, which can be done for those infants who have certain genetic disorders in the family. This is Dr. Shashwati Mukhopadhyay, clinical geneticist of Apollo Multispeciality Hospital, Kolkata, bringing to you the news about newborn screening. Thank you.